Welcome to the Stronger Together podcast, brought to you by Sandpoint Strength and Conditioning. I'm your coach, Kenny Marquardt. Today, I am rejoined by Trina Kennedy. Trina was a guest about a year ago. Her life has gone through some changes for the good, but also some evolutions in which we're going to talk about that can benefit you. So we talk about optimization, we talk about hormones, we talk about just trying to serve yourself and be your own advocate in health. So I think you'll enjoy this, and talk to you soon. All right, Trina. Welcome back.
Yay. Love being here.
Yeah, we were just chatting about the last time you were on here and how you had your leg elevated and you were just pretty close to post-surgery. So
Yes, I was still pretty dependent on a lot of things and laying pretty low in recovery still. So yes, not there anymore.
Is that hard to to remember the suck of post-surgery? Or is it, you know what I mean? Like when you're in it, it's like, God damn it. Like this is the worst thing. It's never going to end. At least that's what I recall from which was 20 years ago, my first repair.
Well, it's interesting because, I mean, I'll fast forward just a minute. So I'm 3.5 weeks post hysterectomy right now.
Yes.
So there is some comparison in my head. Obviously had never had a hysterectomy before. So I'm like, well, the most recent thing I have to compare this to is total knee replacement. And like, that was a sucky thing. Like, I have never slept so much. The pain was, I don't know, I guess I don't recall being in this, like, I'm in so much pain. Mobility was limited. That was the hardest. Independence was very limited. I couldn't drive for a while. Yep. That was hard. But the thing I remember most about the total knee replacement was I slept so much after surgery. And I'm sure part of it was medications, but I think part of it was just, that is such a big traumatic surgery. They cut your bones in half. Like you.
Yes.
Like I have been in the room with knee replacements in the OR as a nurse. It's barbaric. It's
shockingly barbaric. Like it's hard to contemplate. It's hard to like, I've not been in the room for surgery, but having talked to some surgeon friends and understanding what happens. It's in fact, one of my surgeon friends and I took an elk apart and he like popped the hip. He's like, just had this like magic way to pop a hip out. Yep. And I was like, holy crap. And he's like, yeah, that's what I do all day. I was like, oh yeah, good point. But it's on a person that's alive. So, but it was a very like abrupt recognition of like, oh, this isn't like, I don't know.
Yep. It's barbaric, like truly.
Yeah.
There's legit saws and screws and like screwdriver, like there's tools. It's like being in a garage or a shop.
Oh, totally. Yeah. I really think I'm like, they're just like they're just like got freaking screw. They have very sterile, but the same kind of tools that you have when you take apart and put your house back together.
100%. So I think so much of my recovery on that was just that really, like, that's big bone healing. And I was just tired. Like I slept so much. And then moving again, like getting back into moving it. So, and I don't recall if we ever talked about that. I think I told you about it. Like in the course of that knee replacement recovery, I had to go back into the OR for manipulation under anesthesia because it's essentially soft tissues, whatever, it seized up. And I just got to a point where I could not gain mobility any more than what I had. So that's where I remember the pain kicking in, was following that. That was an excruciating pain. So I did the manipulation, and then that same day I went to physical therapy and we moved it some more. But that's also the turning point for me. That's when I started gaining mobility much more than I had before, and I feel like I started making a lot of progress. So it was very necessary. I was most frustrated with that stalemate that I seemed to reach. Yeah. And so that was really hard, and didn't feel like I was making any progress with my just range of motion on the bike. Like that was my biggest goal, to get all the way around on rotation.
That's exactly what that's what I remember distinctly about your recovery, is like watching you on the bike and having conversations and you just could not reach full knee extension.
Yeah, no, that was miserable and frustrating. So I'm like, God damn it, this should be a lot easier than this. So having that manipulation was really helpful. That's where I do remember pain after that. So once that happened, then it seemed to go faster and the pain got less. And then it was just, could start doing things more consistently and being back in the gym and being more independent. And that helped so much. It helped my attitude so much to be able to be back and just move and go back to work and do all that stuff. So that was good. Yeah, fast forward to hysterectomy. Like I'm still in this strange kind of restriction phase, but I feel great.
Yeah, you and I talked about that the other day, and I talked to somebody else. We both know, like restrictions are very, it's a weird window into who the medical establishment is normally working with. You know what I mean?
Yes,
Like
yes.
you can probably,
You're
so
absolutely right.
what, tell me your restrictions, where they've progressed from and to, and where you are now, just because
Okay.
I think you'll make my point.
Yes, I'm sure I will. The first week, let's see, they told me I couldn't drive for the first week, and that my biggest restriction was no lifting more than 10 pounds. Okay. No vacuuming or cleaning. Those were the ones I remember. For two, then once that first week was done, then my weight restriction was lift no more than 20 pounds. And but I should go for a walk multiple times, short walk multiple times a day. I hit that 2 week mark. No more restriction on the 20 pounds, but no weightlifting. I can't start weightlifting until a month post-op. And then I have to, at least I do, I think the parameter is I have to do only half weights of what I would normally do for a month, and then I can progress back to normal. So those were the restrictions that were told to me. So very ambiguous. I'm still in this crazy little, I don't really know what to do with myself when I go to the gym other than ride the bike, do some pretty light, ab work, because my abs are still, they're not waking up, but they're still healing from the surgery. But I feel good. This has been totally different in terms of pain. I had pain for 12 hours post-op. And once that passed, I have had less pain and felt better than I have for the past 9 months. Because that was pain.
Yeah.
So it was needed. It was obviously necessary. I feel great. Swelling is what I felt more than pain. I feel good.
So one point is, I just feel like that, again, the establishment, which is such a broad term, but they don't know what to do with people who actually do fitness. It's like, we don't know. 20 pounds is a lot for, that's just the end of the road. So after that, we don't really know. We want to keep you alive, and that's about that.
And it's interesting you say that. So in my pre-op appointment, I'll keep it clean, but so in my pre-op appointment, my surgeon, she's like, you have really good tone. And I said, well, I go to the gym on a regular basis. And she's like, well, do you do a spin class? I'm like, no, I lift weights and I do CrossFit type training. She's like, that sounds really hard. That was her comment. I'm like, okay. And she's giving me the feedback, you have really good pelvic floor muscles, which I don't usually see in people your age. It's probably the weightlifting. I'm like, okay, cool. That was the comment pre-op. I saw her, maybe it was last week, in my first follow-up. She asked how things were going. I said, I feel great. I have no pain. I'm not taking ibuprofen. I'm back at the gym. And she's like, you're not lifting weights, are you? I said, no. I said, I'm staying with my parameters. I said, I'm riding the bike and doing some really light, core work and, box step-ups or something like that. She's like, it all sounds really hard to me. I'm like, yeah. I just told her, I'm like, you know what? Unfortunately or fortunately, whatever it is, I've been through a lot of surgeries, and I've been through a lot of surgeries at your gym. And every time, the thing that helps me the most and gets me through all this is movement. I gotta stay active. It helps me heal. I feel better. It helps my attitude. It was just interesting hearing that from a healthcare professional. I'm like, and you're right. I think that they definitely write these restrictions, and I don't want to say they're not legit. There was a lot of trauma done to my abdomen. So I understand I need to be careful, and that part's great, but I think those are definitely written for their common customers. And it's not that common for people to be in shape and active and strong,
Yeah. Yeah. Which is unfortunate, obviously, but
it is, but it also is I don't think it's common for the healthcare professionals to be in that state either.
That's a post I've wanted to make for 10 years of should you trust your doctor if they don't work out? And that's the one it's very delicate.
It is.
But it's kind of true. It's a weird I don't know. I'm not sure. I'm clearly biased.
And I know it is a very sensitive topic. We can talk about it in general terms regardless of what a person does. If you know what to do and you don't do it, well, then you don't know what to do, kind of thing. Mm-hmm. And it's one thing to be able to say, oh yeah, I gotta exercise more. Doing it is just a different thing, and it's reflected in how a person presents themselves. Yep. It's organic, and it is. I haven't been in the acute care health setting for a couple years now or more, and it is pretty common to have a lot of healthcare professionals not be in their best health. And yeah, like, it's a good question. Do you trust them? They're human too.
Yeah,
I don't
right,
know.
for sure. Yeah, that's the big asterisk. Like, there's a couple of them that need to be there where it's like, hey, this isn't easy necessarily, but it's also not. I think it's a lead by example thing. Like, if you're going to be dispelling information for me to try and be healthy, which is in the name, and that's like, it's not a theory. Like, it's proven exercise is going to help you live longer, live better. There's a giant disconnect there. And I wouldn't go to a dentist that didn't brush their teeth.
Right.
Like, if they were like, go in every 6 months and just hope they can pry off all the dead stuff and plaque and this, I don't know, whatever. I'm not sure. I don't know enough about oral care other than brushing your teeth.
Right.
But again, it'd be one of those things, like, it's 3 hours a week could be a massive improvement for health for somebody. And if you're not able to do it, that's just, I don't know. I find it to be confounding.
Well, and I think it's interesting too. I mean, I don't think within our traditional healthcare system, it doesn't seem to me, I think that might be the best way to put it. It doesn't seem to me that movement and nutrition is emphasized enough.
Mm-hmm. Yeah.
And it's not, like, there's so much that can be talked about, and people, that's part of what I get to do now. And I love it. I love it because people are hungry for the information. And it's truly just information. Like, I'm not in a space to take them and go, okay, we're going to do this workout now and coach them through that. That's where you live. I live in a different space, but I still get to be able to guide people on the movement side to the best of my ability, and to be able to talk to them about nutrition in conjunction with doing some other health aspects that can really improve their health overall and help them feel better. So, because I think the number one thing that we hear here in this clinic is, or in my work that I do now, is I've been to my doctor, we've done all the lab tests, we've done all these things, I still feel like shit. But They tell me everything is normal.
Yep. That's exactly what I wanted to talk to you about today. But to pause for just a second, and I'm going to ask you a preemptive. Can you tell me about your education to get to? So tell me your qualifications, and tell me your education to get there. And I'm going to ask you a question that you probably already know what's coming.
I'm a registered nurse. I've been a nurse for 20 years-ish and spent a lot of time in the hospital. I've also done some, on the personal side, nutrition training, but I've also done some actual education on nutrition. Worked with you and your gym on movement and nutrition over the years. Currently, I don't have any special certifications for what I'm doing now, but working in the wellness space, focused on hormone replacement and some peptides and weight loss, things like that.
But before your own curiosity and your own experience as a part of the prerequisites for becoming a registered nurse, how much nutrition training did you get?
None.
Zero.
Okay, let me rephrase. One thing I do remember, in nursing school, the only time we talked about nutrition was talking about the American Diabetic Association, the ADA, and the parameters for diabetic patients.
Okay.
And I remember now, I was a very different person back then going through nursing school. But I do remember having the discussion with several of my classmates at that point in study groups and things like that, and we were on the diabetes and the endocrine system, and noticing at that point that, well, we have to follow the ADA guidelines for our diabetic patients, but a lot of what they were getting was carbohydrates. I did not understand what I do now about nutrition and all of that stuff, but if you look at that, I haven't looked at the ADA guidelines in a long time, but so I can't speak intelligently to that, but I do remember, and even being as a nurse on the floor in acute care and making sure that patients had their ADA diet, breakfast or whatever. I mean, there was toast and oatmeal and jam and honey and
holy crap,
protein.
Interesting.
So I remember pondering that stuff, but I wasn't in a place that I openly asked or inquired anymore about it. Overall, training on nutrition was minimal at best.
Yeah, that's what I've come to understand, and same thing on the physician side. Like, I am friends with quite a few doctors, and they same experience. From what I've heard, is in their experiences were like one class, and it was rudimentary and outdated according to what they know now at best. And so I think some of the point I'm trying to make is not that, it's almost not their fault, because that's you get trained in a certain way, and these are the paths that you can take, and this is your scope of knowledge, and
yes,
blah blah blah. So it is a bit of a chicken before the egg thing, like that's what had to happen, or that's what happens because that's what they've been taught. But I think I've gotten in trouble by, I'll tell you who this was later, I'm offline, but I got berated by a local doctor because she's like, you're anti-doctor. And it was kind of it was just observational. But anyways, the point was like, that's not my point so much. It's not, I'm not blaming them, but I think it's important for people to understand that they have to be their own advocate.
100%. Yes.
In terms of prevention and optimization.
Absolutely. And I think we've had this conversation, I don't know, so many times, but one of the things that I have learned, and it seems like being in Western medicine, there's some things we're really, really, really good at. We're really good at saving a life. We're really good at the trauma side. We're really good when there's surgery that's needed, like it's a
Don't come to me.
Go
to the doctor.
Don't ask me, right? When it comes to chronic illness and actual like true prevention of disease and optimization, like I think that we are not doing people a lot of service in that. And I have so much respect for people who have gone to medical school, practiced their craft. They've learned all the things. They've done so much to get to where they are and understand where they are and how to help people in the way that they know how to help them. The training that they get, it's vast.
Mm-hmm. Totally.
I think that there's so much that gets left out that's basic, that somebody deems as basic, but it's vitally important. That's where we start talking about nutrition and movement. I know that there's a vast amount of medications and treatments and procedures out there, and I mean, they all have their good points, no doubt, and they all can really benefit patients who need those. I'm glad they know, because
totally.
I don't. But I think absolutely people being their own best advocate and asking the questions, well, what's the alternative to the medication? What's the alternative to the prescriptions or the procedures? What if I don't do this? What's going to happen? Or what's your best guess? Or, what else might I encounter? Those are all really good questions. I think a lot of people would probably be open to answering those questions, a lot of physicians and whatnot. Some may not. I don't know. I can't speak to that. But, I've worked with some really good physicians over the years and providers, not just physicians, but some are really willing to jump into some not necessarily alternate conversations, but expanded beyond our Western medicine. And I think that there's room for both.
Yeah. I think people just take the wrong exit on the highway for some of their things that they need, and they kind of reach a dead end. This shit's hard. Like, into my side of things, it's habits. It's refinement. It's like I exist as a business and I have for the last 14 years because it's psychology and habit building and like trying to get someone to adhere to the two words of like exercise and nutrition, which I do think that most doctors and providers are probably saying. Absolutely. But my God, nobody doesn't know that. But it's like if you go to you have high blood pressure, you have whatever, like, and they say, yeah, you should probably work out more and eat less crap. That's not enough. They need to, I think people, so in terms of the wrong exit on the highway, I think they probably are getting the right answers, but they maybe haven't explored the other alternatives first. And this is again a bit of a gripe, but like I don't have a lot of relationships with providers who are referring people back
Correct.
to me in my industry. And that's a whole other side road I could get into because I think my industry is a woefully unregulated and probably largely unqualified. And so I think that doctors probably have a little bit of mistrust for the people that you can take a certification for, you could do it right now while we're on this freaking podcast and pass it and call yourself the same thing I can. So there are a lot of problems, but in terms of empowering people and what they should be thinking, I think that it's up to them to realize like, hey, there's a lot of options before you go down the road of something that may be, I don't know, have detrimental side effects, but it'll keep you alive.
For sure. Yeah, maybe. So
sure, fair.
And I just had a conversation with a patient last evening before I left work, and it was, it speaks to this whole, like what we're talking about right now. And the question on the table was about GL. These are like Ozempic is probably the one big buzzword that a lot of people know as a GLP and other weight loss medications. He was asking some questions. There's a lot of information out there. There's a lot of positive, negative, like you can find pretty much any information you want depending on what you're looking for. And he was asking the question. He says, is it true that I can lose my eyesight, I can ruin my joints, and I can lose all my muscle mass? So that was the question on the table. This is a gentleman who is he's got a lot of muscle mass. Mm-hmm. Very obvious. Like he is been in the gym and continues to like take care of the movement side of his life. And per his account, like he supports that with the nutrition that he intakes. And so, I mean, in general, my answer to the question was, you know what, there's responsibility on both sides. When a provider is prescribing any medication, whether it's GLP or something else, it's the responsibility of the provider to prescribe safely. And I don't want to get into a lot of other medications. These are some of the ones I'm familiar with.
Sure.
On the GLP side, low and slow. Like start on low doses, go slow and incremental and up, and what's the response of the patient. That's really the practice that happens here. That seems to work really well for a lot of people. The responsibility of the patient is the foundational stuff that you're talking about, the habits that I have to learn. What do I put in my body to fuel it properly? I've worked with several patients here that they come in with this thing, well, I'm just going to stop eating. I'm like, well, that's not helpful. Your body's going to fight you on that tooth and nail. Let me tell you what's going to happen.
Yep. You'll also lose your muscle mass, eyesight, etc.
Exactly. Yep. Like it's the same results. So like, and so well, like helping people shift even slightly their mindset on nutrition, because that's a big animal. That's kind of like talking to people about religion and politics. Like nutrition can be a very triggering topic, and it's a very emotional topic for most. There's a lot tied to food, right? So the movement side can also be very, like people get their heels dug in, and sometimes they don't understand how simple it could be. I mean, everybody has their own blocks, right? But I think, kind of going back to what I was originally talking about with this particular patient is this idea that, yes, providers have a responsibility to prescribe safely and effectively and monitor their patient. If we're going to place these folks on any medication, these medications that we deal with here, we make sure and educate, like, here's your responsibility. Here's what you can do. Here's what you need to do to make sure that that you get the effect that you want. So it's a twofold, and they're both very big responsibilities. Probably more so on the patient but it's both. It's a very big responsibility on both sides.
Yeah, that's as I was so excited to hear, like, just all you were saying, because it's like, it isn't either one or the other. And again, so this is just an airing of all the times I get in trouble, which is actually quite frequently.
What? Shocker.
Yeah, weird. But I sent out some email like 3 weeks ago or something that was like, hey, drugs aren't bad. Like, it was, I guess I should rephrase that a little bit. But like, medicinal intervention is not, like, I am not the guy, as much as I just said, like, hey, fitness, nutrition, like, that's not necessarily the end of the road. Because you are fit and because you are consuming good foods does not mean that there isn't a place for medicine. Like, I think there's a stigma around medicine that people are so like, I don't want to be on any medications. Like, I don't trust people, whatever the reasons are, but I think they tend to feel like I'm going to align because of the things that I say, that I'm like Mr. Paleo. We should go back to like the 1700, not even, we should go back to like Paleolithic era and only rely on food and movement, and everything's going to end up happy and, perfect.
Well, that's all they had back then. So there's that.
Right. Yeah. But they also lived to be like, just past reproductive age, and then they'd be dead. They'd serve their purpose and like la-di-da. Yep. So, I think that, and what we can get into in a second is like that if you're doing all those things and you're still like, feel like shit, and you still like, there's like, with a responsible prescription and knowing and continuing to perform those things, like that's where like this longevity movement, where people are trying to live to 100 and live really well to 100 and beyond, it's probably going to be both. Relying on just one, if you just work out and just eat well, you're probably not getting the optimization. And if you just take medicine and don't do those other things, you're not going to live well either.
Exactly.
We should be holding hands and working in conjunction to optimize people's lives.
Yeah. Yes, and I do think there's a lot of nuances to that, which has, kind of ties back to some of the things we talked about before. And those nuances are helping people understand that when they say, as you reach, I'm going to talk specifically about women's getting into her 40s and 50s and going through that perimenopause stage. And they're like, well, this is just normal. This is just what I have to go through. Yeah. And that's affirmed by many physicians that they speak with. And they're like, yeah, I mean, almost like it's a rite of passage that's what they have to go through. And I'm like, well, okay. So yes, women have gone through this for a million years, right? Like this is how our bodies work.
because you'd be dead before then. Like, again, like looking back to the, like you'd have raised the children to survive. Then you're dead. Like,
Done.
sorry, your purpose has been served. Get out of the way.
Exactly. Room for the next, room for the young, right? Yep. Well, we're not in that space anymore, and we do have a lot of options to actually help people feel better. And some of the things that we go through, like fatigue and, like joint pain and some of the, like, just feeling super tired, not able to sleep, whatever those things are, like, those are symptoms of something being off. That's not just you being 40, 50 years old and perimenopause. Okay.
Yeah.
Maybe we can call it that, sure. But it is a symptom. And I think those types of things aren't always looked at. Maybe they are, but I think I've heard some patients be like, well, that's not a symptom. I'm not going to treat that. Okay.
Well, and how much of that is what we were just discussing? Like, again, with a primary care physician, my experience has been like, if you're alive, you're good to go. Like, get out of my office. Like, not, like that's a pretty extreme, but I'm not alone in that. I can't even tell you the last time I went to my primary care provider, who I like. I think she's great. But 90% of the time when I go in there, she's like, what are you doing in my office? Like, your numbers are good. You're walking on your own 2 feet. Like, did you see the people in the waiting room? Like, they came in on scooters and with oxygen tanks. Like, get out of my way so I can help the people that actually need it. Which, understand, again, there's a lot. Like, they get 90 seconds a patient or something insane. Like, but the same thing, the same symptoms and stuff that I think you were describing just now was like more of a preservation than an optimization. So there's, now with the alternative methods of care, which I'm not sure that's the right term for it either, but, these other medicines and people who can focus on optimization, that's a great route to take, or a great path to explore. And you don't have to just, suffer your way through it.
You don't. And I mean, there's other hurdles that come up with that, but yes, there's options. And it's hard to, and I'll speak a little bit more about my own experience. I was stuck in that phase. Like, even in reference back to my hysterectomy, for example, I am that person that I push through a lot of things. I've done that all my life. It's not really a great trait.
It is a great trait, but yeah, it's like there's a line to that. It gets great.
Kind of my way,
yeah,
right?
Yeah, I think it's a great trait, but you also gotta know when.
Yeah, self-awareness apparently is a little low on that one, but
asking for help isn't bad.
So, with the symptoms that I had this year and the pain that I dealt with, I just pushed through. I was like, oh, it's fine. I'm coming into menopause. It's no big deal. Like, it'll be over soon. That was I told myself that. Like, my body will take care of this. Yes, even though I know I'm educated and I know some things, this was what was happening in my head. And I did it until I got tired of it. And I was like, oh, fine, I'll just go see somebody. And then, I got to that point where it was annoying enough and bothersome enough. And really that happened when I started leaving the gym because I was in too much pain, or I wouldn't go to the gym because I was in too much pain. I'm like, oh, this is dumb. This is going to start interrupting my life in a major way. And I don't like that. So that's how, I chose to go in. But I really did in that space go, it's not that bad. It's fine. Like, my body's working its way out. Like, it's going to figure this out. So clearly that I needed help in getting through the hysterectomy, and I feel so much better. So that was kind of the major surgery part. Separate from that has been to optimize my health in some other ways in conjunction with that, and to get to a place where I have consistent, sustained energy. My sleep is consistent and sustained. My energy restores every night. My eating is pretty regular, and I say that because I do know that there's so much with eating that's habitual. However, to have my appetite be regulated, like, that's pretty significant. And to be like, oh, I'm hungry, and to give my body what I know it needs, like, that's incredibly helpful. So to feel like I'm closer, I don't know if I'm there because I've never really been in this optimized, fully optimized state, but I'm better now than I was. And this is pretty freaking cool. And I don't really know how to describe it to people because people are so used to being miserable.
Yeah, totally.
Yeah. So, and I've seen this as well, like, it is still variable. I think that's the one thing I've seen as a nurse my entire career. How you respond to one thing might be different than how I respond to one thing. Sure. And it's no different in this space that I'm working in now. We see really good results with a lot of people, but how they respond and what works for them might be different than the next patient. So working with that individually is really, that's part of what makes it fun. But overall, hearing over and over and feeling it for myself, like, I feel better than I have in years.
Yeah. I feel like myself, again, something I've heard a lot from people.
Yeah.
Yeah.
Yeah. Like, man, I forgot what this feels like to like feel like a human and not have to feel like I'm suffering or miserable. Suffering is a little harsh, but miserable every day. Right. Or look forward to the end of the day when I can just sit down and that's the one relief I get. See, I don't have that anymore. I don't know. There's options, and you do have to do a lot as a patient to explore some of those options. That there's a lot of providers out there that will say that's not a good idea on some alternative methods, but ask the questions yourself, I think. And I've always encouraged patients to do that, even when I was in the hospital. Like, you got to ask the question. You are your own best advocate. And it's not that somebody's trying to withhold information from you, it's that they're so busy. The entire staff that's dealing with you, they have so much on their plate, and they can't know what your questions are unless you ask them. They're going to hit what they think are the important parts, but you got to ask the questions, the things that are important to you. And that's how we know how to better educate you. So, yeah, and education, it's, I mean, a whole other passion of mine that I've had for a long time. But I can't know what's going through your head unless you tell me. And so ask the questions. That's what I mean. We tell people that all the time. Getting into this optimization space and like exploring what can I do in addition to going to your regular checkups or whatever, maintaining your blood pressure, or eating, whatever it is. What else can you do if you feel like you need to do more? And yes, there's some hurdles to that, but there's ways to work around it too.
Yeah, and you said something that I've experienced a lot too, is the vulnerability, people's ability to be vulnerable with a professional. Like that's hard, and it's a big ask. Like I don't want to diminish that in any sense. But once you have found that person, like that vulnerability to ask those questions is so helpful. I mean, again, from my perspective, when people come in and tell me everything, because I don't care. I mean, like just like I actually wear a white coat, but at the same time, like I'm in here, and it's like this stays here. I've got there's almost nothing you could tell me that I haven't heard before.
I'm sure.
I'm good. Like I'm just here to help. And the more you tell me, the more I can help you. And the same, exactly. I think would go for you guys.
Yes. It is exactly the same. And you're right. And that it is hard for people to be that vulnerable, especially when they're like, well, I just met you.
Yeah, right. Totally. I've got no libido anymore. I don't find my spouse attractive, blah, blah, like whatever it is, which is, the commonalities I think of, especially with, we go down that road for.
Well, sure. But what I do end up finding, and this, I mean, I think it's interesting being in this space where people have done enough research to have at least an idea that maybe my hormones are off because I love my husband dearly. This is one thing I heard recently. I love my husband dearly, but he's chewing celery and I can't stand it.
There's a thing there's a title for that. I can't remember what it is, but it's for some reason that came up in a conversation the other day. I don't remember what it is. I hope somebody can tell me that.
No, so like these are legit things, and people, whether it's men or women, they feel bad. They're like,
sure,
it should not be like this. I'm like, yeah, you're right. So, like I said, a lot of patients that come in, like they've done enough research to know that something is off. And not everybody's comfortable talking about their sex life. Some people will give you way more information. Totally fine.
Yep.
But yes, having it's hard to ask the question and be that vulnerable too, because some people can feel like, oh, well, I'm weak now, or they're going to think of me as stupid or whatever. The other space to that is a lot of people don't even know what questions to ask. Like they feel lost, but they have no idea what to ask. And that's a tough space. It's really tough for the patient, but it's also tough for us because, again, we're trying to educate to the best of our ability, regardless of whether it's here in a hospital setting or wherever, but we're trying to educate to what we think is important and what we think they need to know, but they might still feel incredibly lost. Like I've seen it in really bad diagnoses like cancer, for example, where like, you have cancer. There's all these questions written all over their face, but they don't even know what to say. And they're like, you go, do you understand? Yeah. And then they leave and they have all these questions, So, I mean, obviously that's a little extreme and I don't have to deal with that these days, but it's hard to know what to ask. It's hard to feel comfortable. I think people who have gotten to the end of the rope where they can't stand the sound of their spouse chewing celery or something else, like I have issues, I got to do something. And they reach that space.
Yeah. And I think it's empowering for people to be a little bit transparent with that stuff. I think I've heard the women testosterone intervention thing has become much more talked about. Like there are a lot of women open about which is, I think, phenomenal because, and I don't know how I'm a man. I can only talk about this from the outside perspective. But I feel like that's been something that they would have never considered. Never, ever in a million years would have they have thought to get them tested. Yeah, to get their hormones and like whatever. And now that that is now happening. And then we can go into why that's like, I think I talked about this with Sarah, but as far as like the research that was flawed and
Oh yeah.
it was going to cause breast cancer. And
Well,
it wasn't the testosterone side of things, but it was
the estrogen.
Yeah.
Yeah. And we've come a long ways in our research, and some of that initial research that was done that told us how bad things were and how that was going to kill us. Now there's more research now with other things to say that wasn't altogether true. And there's things that we can do that is very, very safe for many and can help you feel better. And on the testosterone side for women, I think that I was that person. I did the judging of other women who would say, "Oh, I'm on testosterone." I'm like, "Why?
Yeah.
You're not a guy." Fast forward to now, I feel great, better on testosterone than I ever have, than I was before. And again, these are very different than it's very drastically different dosing than for men. It affects women. It's such a different thing, but it is a necessary hormone for all kinds of things. For example, and we see women that are on just what we call a sniff, just a tiny amount of testosterone, and that's all they need to make them feel better. We also have women who are super active, and they essentially burn through their testosterone, so they're on much higher doses, and that's what's effective for them. So, and I had never really considered that. Those women that are more active, and men too, it's not isolated to women, but people who are more active are going to burn through those hormones, that testosterone, a lot quicker than somebody who's inactive. Mm-hmm. Can still be effective. Activity is not the caveat to efficacy of testosterone, but it's how the body uses it is drastically different.
Yeah. And I think that's where that similar in vein to where I wish more general GPs would be interested in holding hands with my industry, the same with yours. I just feel like there's not a great referral. Yeah. I think that you guys, and sorry, we haven't even talked about, I talked to Sarah, but we haven't even talked about where you're at, but at Revival.
Yes.
I think there's a bit of a stigma, just like within my industry, there's a bit of a stigma of these black box shops, just handing out drugs. Yep. It's it feels like the medicinal marijuana thing back, whatever. It's just go get your card and you can have all the drugs you want. Whatever. Go nuts. Yeah, totally. But at the same time, it's the lack of that and for men, I know the range of optimal, let's say free testosterone is between whatever. It's 300 and it's 900 or something crazy. Total. 250 and, total. Yeah, sorry, total. Not free. Yep.
I don't forget what the lower 250 might be.
It's something like that. It
depends on the lab. I've seen it as high as 1100 on some in terms of the normal ranges. Normal. Right. So, here's the other part about those numbers too, is that where you feel good might be outside or above those normal levels, and that's optimal for you and very safe. So that's the other part too. And you're talking about holding hands in collaboration with providers and other folks in your industry as well as in ours. I 100% agree with you. And I've heard it from some patients that, shared information with their PCPs about what they're doing and how much better they feel. And to legit have these providers say, "Oh, wow, I didn't know that could help." For example.
Yeah.
Postmenopausal woman going into her GP or her PCP doc and saying, "I thought I was headed for a hip replacement because my hips were so dang sore. I've been on these hormones now for 3 or 4 months. I don't have any hip pain anymore." Yeah. Yes, there's a correlation between low hormone levels and joint pain, specifically hip pain in women. So it can help. And just having an understanding, PCPs, that's your family practice. That is your specialty. You do your genius. We want you to. We 100%. Really because we're not doing that. I'm not a provider. I'm a nurse. However, that's the specialty. Mm-hmm. That they do. We want you to keep doing that. It would be great if you had some understanding, a little bit more understanding about hormones and how it affects all of the body parts, not just libido, because it does affect everything. Also understanding how it affects people as we age and how it can be helpful. So that in the end, in correlation with the move more, that can really help you too, making sure getting adequate nutrition. And even the simplest nutrition training that I do with people is when you put food on your plate, put protein first. Eat protein first. Most people don't get enough protein. You know that. I'm preaching to the choir here. You're the original who taught me so much about that. So, but it's so common. So common.
Yeah, and you made a reference to nutrition being like religion, and I'm going to offend some more people and say it's all the same. there, like if you do enough research, you realize like most religions, like at the end of the day, like similar stories, similar same stuff. Like what you may have the same God, you may have the same, but like proteins, no matter what one of these things you're talking about, protein is coming first. Like, and or it's probably not valid. So however you want to get there, I don't whether it's I don't whatever we go down that road, but in any event, protein first in terms of education side of things. Yeah, sorry, I just wanted. Felt like I had another opportunity to get some emails written to me, so I figured I'd jump in.
Love it. I always love hearing about when you're in trouble.
Yeah, good. I'll forward you my collection one of these days. Because of the range of men I've encountered, and there's a whole lot of nuance that I've actually just after having conversation with Sarah and like kind of I listened to a good. So I think everyone should listen to from Peter Attia the other day about testosterone as a biological evolution. It was really good.
Oh, that's interesting.
But 300 to 11. I've had male patients that were like, yeah, my doctor said I'm fine. And I looked at their blood work and I'm not qualified to do any other stuff. But I'm like, that's, as far as I know, that's probably low. Pretty low. And they're like, yeah, no, if I say I'm fine. I'm like, well, you just told me you're tired all the time. You feel like shit. Like, I don't know that you're fine. No. You're alive.
Again, you're pink, warm, and dry. Like that's our classic across the room triage that I used to do in emergency room. Pink, warm, and dry. They're not dying. They're sitting in the waiting room.
Yeah. Yep.
Right?
Yeah.
And especially when it was busy, like that is a legit thing. And yes, your primary, same thing. Like you're talking, you're breathing, you're go, you're fine. Yeah. Right. So I do understand that. It doesn't mean that you feel good. Mm-hmm. And again, I think that's where we, can get definitely down a lot of rabbit holes in this optimization thing. Again, if more providers simply had a little bit more understanding about just because the lab. And I don't want to qualify all labs because I don't feel like I'm qualified to interpret all those things either. However, when we're talking about hormones specifically, even thyroid, and I'll use myself as an example. I've done all my female care yearly ever since I started having children 26 years ago, right? It's been a minute. So I've done the thing that I'm supposed to do. I go in for my checks. I've had my pap smears, my mammals. Like I've done all those things. I've had my blood tested very regularly. My thyroid's been tested very regularly. And I've always been told, your thyroid's fine. Like all your numbers look great. I never had my hormones tested until recently. All the other things, everything looks great. Yeah, you're healthy. Go away. Not necessarily like that, but like you're good for another year, right? Yeah. Yep. Okay, cool. I have Sarah look at my labs and like, okay, I'm an open book. Like, teach me. She's like, your thyroid's on the struggle bus. And I went, okay, help me understand because I've always been told it's normal. So what are you seeing? And bottom line is she looks at the relationship of those numbers very differently in understanding not just how the thyroid affects and it functions, but also how it affects hormonal function. So for the first time in my life, here I am on my thyroid's getting some help. I feel better. You know what? My hair's not falling out anymore. Again, I thought that was like, well, I'm just older and this is how it works.
Yeah. Yeah.
So yes, whatever. And to be fair, I know so many of these providers, like they're looking at so many data points. And I don't want to minimize that. Like it's a lot of information and they have a very short window of time to weed through the complaints that a patient might have or the list of ailments that they're struggling with. And they got to pick something that's like the most important thing. Mm-hmm. And if all the labs look within normal limits, those are the ranges they go with. Various caveats to that, but I think that that's pretty common. And so I think that's why we see a lot of people that we do. And there's some lab ranges that we definitely practice outside of, if you will. And again, to the safety and optimization of those patients and how they feel.
Yeah, and I think it circles all the way back around to the like advocate for yourself thing, and that you should do your own research. And to an extent, I say that with the caveat of like, if you go on WebMD and you find out everything, it's all cancer and you got 3 hours to live, like that's detrimental. But to all of it, I've learned a lot because I'm kind of a nerd, but through reading, through listening, through paying attention, there are things that I ask for that are not a part of a standard set of labs. Like I have a history of heart disease in my family, so I want to know about what my ApoB or apolipoprotein B is. That's not on a normal test.
Correct.
That will never get tested for.
Exactly. But it's important information in your case.
Totally. Yeah, very important. And so, nobody's at fault for that necessarily, but it is one of those like, okay, well, at least, and so when I ask the question and I get, oh yeah, we can totally put that on there and then let's see what it is. So, it's don't go treat yourself. I think that's probably the other side of it. Don't go like come up with your own diagnoses based on the the one thing you come up with. Ask ChatGPT and go get your drugs from somebody. But, be curious about yourself and find somebody you trust that you can ask questions to. And like you said, Sarah said, she said your thyroid was on the struggle bus. You asked her, tell me more. Totally. Yeah, exactly. And then, you guys can come to a decision together. That's magic.
Yeah. Well, and I think that's also where there's, at least in my experience, it was never, I was always told everything was normal. So I never had the opportunity to be like, well, help me understand exactly how it's functioning. Because I was just always told it was normal. And to be fair, I was never that person that looked at my labs and be like, well, okay, what does each one of these values mean?
Right.
I see that they're within normal limits, but what does each value? I never really had the drive to ask. I didn't have anything that was driving me to ask. Now I ask more questions, especially when there's numbers that somebody else sees as something that's my body is struggling with, and I can be like, oh, well, help me what should we be seeing? Like what would be a better, what do you want to see do you think would be helpful? And the numbers are only part of it. And I think that's one of the things that I love so much. That's one thing I was taught very early on as a nurse, treat your patient, not your numbers, right? So very good advice. And it's no different here. The numbers are important. They're data points. And I'm kind of a data geek as well, but we have to have the data of what's the patient's experience? What's the feedback they're giving? And that can be hard in this space a little bit too, even including myself, because we go low and slow in our treatment of patients, whether it's hormones or weight loss or whatever. There's a lot of patients that they'll show up, a couple months into this treatment, they'll be like, I don't feel any different. Okay. Sometimes that's us getting creative and asking some specific questions. Well, tell me how your exercise experience is. Are you noticing anything different then? That's when we start getting some of the nuances of, okay, we're hearing some improvements. They don't have the big drastic, I feel like $1 million right now. And it's likely because and I had this too, where my dosages needed to be increased a little bit before I got to that space where I'm like, this is what they're talking about. This is that optimization level. It takes a little bit. But again, doing that in a low and slow manner versus those higher doses right away really helps prevent the negative stuff.
Yeah. It's same here. Again, in this field, it's the same. And trusting the process. Somebody asked me the other day, what's the thing I've learned the most important thing I've learned over the last 15 years or something. And it's just trusting the process and showing up, and also relying upon the professional to say, hey, this is what I'm experiencing. What should I change? Because it's not one size fits all. It's not show up. Showing up for me, it's 95% of it. But at the same time, it's also understanding that you are an incredibly unique organism with different life experiences and a lot more that you can't expect that you're just, like you said, you're not just a set of numbers that exactly. I can look at the thing and say, hey, this is exactly, I don't know. I have to ask more questions, and you have to trust me, and you have to trust the process for longer. Yep. So we can get your prescription at this point in time. Good. It'll probably change over the course of the, what we're working together. Well,
and I think there's another layer of this, which I know you work with this side too, is the mindset. That's a big bucket. That's a whole nother podcast, I think, probably all in itself. But talking about mindset in a person actually thinking about and going, I am feeling better, I'm doing more, versus the focus on the negative. I've seen, I've done my own coaching, and I still do to a certain degree, but there's so many people, they're so committed to that negative story.
So interesting, yeah.
And that wins regardless of the treatment, even though we see improvement and we're like, oh, but I hear you. You're doing better in this area when we ask the specific questions. Or we see it on the in-body. We see changes in their body composition. This is huge. You're making so much progress. Oh, but, I still blah, 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 blah. And they go back to that commitment on that negative thought process. I'm like, one of my responses to that is, well, you're the number one person in your way. So if you want to be happy about this, I can help you.
That's so interesting. Like you said, that's I'm just kind of a joke that I'm an I'm a glorified PE teacher. But at the end of the day, it's really more psychology than it is anything else. And I guess I didn't make that same connection for you guys, but you're right. I think people sometimes just identify as blank, whatever it is, and they're going to feel that way no matter what the data says. Huh.
And we do see it. And it's interesting because I have seen, and it's been really freaking cool to see, we can usually tell, the mindset that's coming through the door. They're desperate. They want help. We get started. And I'm thinking of one particular patient right now. She was very, 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 very stuck in her like, I just feel horrible and I feel like a blimp and blah, 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 blah. She went down that road. She committed to the medication that she was on and the treatment plan that we came up with for her. And I helped her with some nutrition stuff and some guidance on movement stuff. And she, like, that was 4 or 5 months ago, I think, when we first saw her. And I remember thinking, God, I don't know if she will open her mind enough to consider the alternative to her misery that she was in when she came in the door. Because she seemed very, very committed to it.
Sure.
And I wondered if she'd stick with it. She is one of those that I've loved working with. And there wasn't a definitive corner for her. And it actually happened to be with the InBody. Because she didn't believe me. She didn't believe me that something had changed.
Yep.
And I showed her the InBody. I'm like, you have gained muscle. You have lost fat. You have lost weight. This is progress.
Yeah.
She's like, oh my God, I'm doing it. I'm like, yes, you are. So, and you know that feeling, like you've been there. You've helped people get to that space. There are certain people that are just more committed to the misery than they are the joy of it.
How much does that relate? We're going to go full circle now and talk about, so your knee replacement, like there's a weird, when you were describing that, and part of the reason I asked about it is like, I feel like it's a very similar thing I see with people getting started on their exercise nutrition journey, where there's so little progress in the beginning because that's, like you said, low and slow. Like, I don't want to burn your marshmallow as we get started. Like, you got to, I'd say, a nice golden brown, if anything. And it takes a minute to start to feel it and notice it, but then that momentum carries. And if you can get over that hump, like you do kind of, you have a new freedom of mobility in life and et cetera. And it's kind of hard to remember that old version that was immobile. But most people don't give it the time or recognition to realize that momentum is carrying yet.
Well, and I mean, I'm sure you've heard this before, and I've said this to many people, is for various reasons, and it really doesn't matter what we're talking about, if we're talking about being in the gym or recovering from knee surgery or whatever, or nutrition, losing weight, whatever. Motivation is bullshit. It's never going to show up. Motivation shows up when you've been consistent enough to see some kind of change, right? So I like to teach to consistency, and consistency is a pain in the ass, because there's days when I'm like, I don't want to.
Yeah.
Like, I just don't want to. And I mean, I had somebody ask me one time, well, what gets you to the gym on a consistent basis? I'm like, you know what? It's just part of what I do.
Yep.
It's just the thing that I do. And I mean, I wake up at 4:30 in the morning, and it doesn't matter what I've been doing the night before or whatever. It doesn't matter. I'm up at 4:30 every morning. That's just how my body works. And when I do have those conversations with myself about, like, it's really cold out and my covers are nice and warm and I don't have to go to the gym, but then I have that argument, like, well, what else are you going to do? It's built into your day.
Yeah. Yep.
You know, and you'll feel better. So
yeah, but that, again, that's the hardest. I don't know how to. That's an interesting, like, so you're part of our 6 a.m. group, and 6, 7, and 8 are the busiest, craziest times of the day. The afternoon is much less so. And what I've observed, it's like that is it's built in, it's right there. There's nothing that's occurred to get in the way. I mean, other than you, which is not you particularly. I just mean in general.
Exactly.
The afternoon's the other way around. People tend to find reasons that they don't have to. So the consistency of the morning people is just infinitely more recognizable than it is in the afternoon. So I don't know what the point of that was there, other than to say, like, if you just make it a part of your day and that's just what it has to be.
And I think that's what most people that show up at 6 o'clock. I mean, I looked at the list this morning, and granted, I'm not doing a lot of the workouts that's programmed right now because of my restrictions, but I still showed up, right?
Yeah.
But I looked at the list, and it's pretty consistently the same people. And I think it's kind of the same thing. Well, this is just what I do every day. Like, it's built into my day. I don't know. I started out at the 5:30 class. I don't know if you remember that. That was where I started in your gym.
Yeah, I do.
And I was testing the theory as to whether or not that was actually going to help me.
Well, yeah. Yep.
So, but yeah, no, I guess on the flip side, and talking about the afternoon, one of the things for me, and I don't know if this fits for other people, but I'm also that person. If I'm paying for this particular service, I better damn well use it.
Oh, yeah.
Right?
For sure.
And, that's just kind of a thing. And it's become like, this is so not about the money anymore. It's about, this makes me feel better. These are the people that I get to see every morning. I love that. So there's a whole lot more to it. But you're right. It's really difficult, especially, like, again, back to that mindset piece. To get to that mindset of shifting from being comfortable in the misery that I'm in, or the overweight, or the immobility, or the sedentary, whatever it is, whatever the thing is, to shift from that to make drastic changes to include movement, especially movement. Like, that's such a big one. that's a hard change. It's not an easy one for anybody. And it seems like I can make it really simple in terms of what are you going to do one thing today that goes towards your movement? Just pick one thing. That one little simple thing sometimes is really a big hurdle for some.
Yeah, I think there's a lot of identity in that where it's like like the statement you just made, like it's just what I do. Mm-hmm. That is, it's a hard evolution to make that like this is just what I do. But once it's there, like that's amazing.
It is absolutely, and I think this is my theory. I don't know. Not everybody's like me, and that's good. But I can overthink anything with the best of them. With something like this and going to the gym on a regular basis, and it's just become that thing that's a part of my life. I don't remember being in this space of overthinking it so much. I just knew I wanted to feel better. Like that was my biggest motivation. And I didn't really know what exactly was going to help me back then. The one correlation and the one thing I did have, the one piece of data that I did have is before my accident so many years ago, I was moving and running a whole lot before my accident, and then it all stopped. And I knew then, like I had reached that place of I feel like shit. Yep. And the one thing that helped me feel better back then was movement. That's, when I came to you and like, well, this is all new and I don't know what I can and can't do because everything is different now, but I feel like shit and I just want to feel better.
Yeah. I mean, but in the trusting of the process, I think that's like, so finding the professional that you can trust. I'd like to think I'm in that boat. I think you're in that boat and you're feeling, you know what I mean? But like find somebody who has got your best interest at heart. Be willing to share how you're feeling and what you would like to see better, and then trust the process. Like that's, again, for both of us, it's like, I can't guarantee I'm going to get it right on the first time. Like I can use my experience to guess, but over the experience, like just keep coming, keep showing up, trust the process, convey if it's working or not working, and then we can adjust. Like
we'll pivot. Yep.
Yeah,
absolutely. Well, and the thing, one of the things, and I mean, this is personal to me. You have a gift for listening to people and really hearing them and validating where they are and accepting them where they are. That's a gift that a lot of people need that a lot of people don't get. Right. So, and I think that's one of the things that's made you so successful. I know it's helped me a ton. I mean, we've gone down that road before, and forever you will be a mentor of mine and have a special place for me. And that's a big part of the reason. And I know that that's part of what I can bring into my own practice too, because it's one of the things I know that I do well is listen to people. It's really helpful. And it doesn't, like you said, sometimes you don't even talk. Like how many times have we had a conversation when we did not talk about business, we did not talk about the gym, but we talked about my dog dying or something else. But that's where I needed in that space, and you opened that up for me. Like that's such a huge thing, because all of that really is part of the process too, and it keeps us stuck sometimes.
Yeah, 100, and I think that's back to the organism. Like that's not the most like soft way to look at it, but everybody's got stuff. It's the basics of this is so easy. Protein, move, blah, blah, blah.
That's just the data.
Yeah, it's just that's the numbers, exactly like you said before. But everything else is the factors that make it work or make it, make the nuances important. So
well, and I think it's, one of the hardest things to do is to be able to have that epiphany. Like I can affect that change. Like the stuff is the stuff that doesn't really change. The protein is the protein. The workout is the workout. Like that's the constant. The variability is me. And the me part is the mindset. What are my thoughts? What is my attitude? What am I bringing into this? So there's a whole lot, and that's where things can get messy if we let it. It requires a lot of vulnerability and a lot of humility at times to be like, okay, here's where I've gotten myself. And that's that, again, back to that personal responsibility part of like, wherever you find yourself, wherever I find myself in any given situation, I have responsibility in. And I got to own that part if I want to shift something. This is no different.
Yeah. Yeah. And thanks for being so, like, you've been vulnerable with me since, I don't know, however long ago it was. But like walk in and let me hold your damn hand while you stepped up to plates. And, that's not easy to do. So,
no, that was tough, but that was a gift. I will never forget.
Yeah. Well, thanks.
Yeah. Well, thank you. Here we are today. Right?
Yeah. I was going to say we've gone for an hour and 10 minutes, so we should, we could do this for forever.
These are always great conversations.
Yeah. No, thanks for being you. Thanks for what you're doing. People can find you. You guys are up here Mondays now at Revival.
Yep. Mondays, Revival Wellness Clinic. So we have, our Sandpoint Clinic. We are open definitively on Mondays. I have been doing by appointment only for some patients. Again, what I do is more limited than Sarah, but I can set up blood draws, I can deliver medications, I can do some IVs, and those can be set up by appointment only. So give us a call and ask the question. Otherwise, we're in our Hayden location Tuesday through Saturday. But either way, give us a call and we can be able to help you out.
Yeah, you can book online too. And just as I've got my interest in this is, just for the good of the world. But I think getting your labs done, regardless of what you end up doing with those, is just important as a check-in, for limited outlay and resources and time. You get a window into what may be going on, or is definitely going on within you. Yes. What you guys decide to do with that afterwards is up to you. But I think just getting a pulse on that.
Absolutely. And when checking, labs are so important. I 100% agree with you. I do encourage patients to don't look all the abnormals up online. Let's talk about it when you get here.
I asked you about that last time. I said, you're going to let me look at these before I talk to you?
Yes, we are. And we have felt the pain of that on occasion. But you know what? The part that I actually really love about that is they're looking and they're wanting to learn. Okay, so let me help you understand, because one number is not, it's just one number. Let's look at the bigger picture. We need the data, but we need to look at the big picture too.
Yep.
So, yeah. No, I agree with you. Labs are very important, and get to know your information. That's part of it.
Cool. All right.
Yep.
Well,
awesome.
Everyone go see Trina. We'll see her in the gym at 6.
Yeah.
All right. Thanks for doing this. I'm sure we'll do it again soon. So
sounds great. Love it, Kenny. Thank you.
Yep. See you in the morning.
Yep.
All right. Thanks for listening. Hope you enjoyed that. Just if you didn't catch that at the end there, you can find Trina at Revival Wellness Clinic. I think that's .com. You could probably go there and book your appointment. And same thing, in terms of just getting a cursory overview, or not even cursory, but an in-depth overview with a professional. You can do that with them, but you can also do that with me. Happy to chat with you about your fitness or your nutrition, just as a check-in if you want. No obligations at all. You can just shoot me an email, kenny@sandpointstrength.com, and we can talk about anything and everything you'd like, and I'll give you my opinion on what you can and should do. All right. See you.